Well, good afternoon, and thank you for joining us. My name is Charlie Moses. I'm a coordinator here with Washington Breeds, and I want to welcome you to today's webinar that is part of a short series from Washington Breeds on improving cessation treatment. Um, Let's see. So Washington Breathes, we are a statewide coalition. We work together to reduce the harmful impacts on our communities from commercial tobacco use, sales, and industry tactics. And we welcome you to join our coalition. Of course, all are welcome. On the next slide, you will see that we encourage people to get involved at whatever level works best for them and fits their availability. There are many, many different ways to participate, as you can see here on the screen. You can join our email list. You can use our online resources. You can come to a training or to a webinar like this, or you can get more involved through our work groups and policy change learning circles. And there's more information and ways to get involved on our website at washingtonbreathes.org. And on the next slide, just a bit of information. We've developed short, informative videos for social media and other educational use. 4 of the reels focus on ways to support youth prevention and cessation programs, which I am sure all of you who are on this webinar today are interested in. This content is available for you to reshare and post, so please do check it out. Look for us on platforms like Facebook, Instagram, LinkedIn, YouTube. And you can find links in the footer of our website on washingtonbreeds.org as well. But you can see them here on the page too. All right, so without further ado, it's my pleasure to turn the session over to Crystal Shen, who's a member of the Leadership Committee of Washington Breeds, as well as our supporting Healthy Youth Work Group. We're so glad that Crystal is here to share her expertise and experience treating youth. And during the presentation, you can put your questions into the chat or hold them until the Q&A at the end. So, Crystal, I will turn it over to you.
Great. Thanks, everyone. I appreciate this opportunity to help share some information. I am going to pull up my slides to share. Okay. Everything look good? Great. And I'm a pediatrician, so I am a general pediatrician and I work in primary care. So I see kids all spectrum of ages, including many teens. So I've worked with teens clinically from a youth nicotine addiction standpoint. And I've also been quite involved with our National American Academy of Pediatrics under section on nicotine and tobacco control, in addition to Washington Breeds. So things at different levels from different resources. And I am excited to be here today to share with you about understanding youth nicotine addiction around the health impacts, as well as cessation resources and strategies. And for just a quick outline of some of the content that we'll cover today during this webinar, I'll go over a quick view of some of the tobacco and vaping products that are out there now, though they're constantly changing, and also talk a little bit about their nicotine content. And then we'll delve into the nicotine impact on youth and the developing brain, which ties into nicotine dependence and addiction for youth. And then we'll head into cessation strategies, as well as specific tools around that, including the Ask, Counsel, and Treat model, as well as different resources around behavioral support and pharmacological treatment in the form of like different medications. And there'll be some different opportunities to learn about Washington resources and some question and answers. And for for this slide, I always like to highlight some of the things here. This is actually from our AP website that's adapted from the Centers of Disease Control, which highlights a couple of like the main categories of different products that are out there now. There's so many different types of e-cigarettes and vaping devices that are becoming that are so prevalent. And there's also some heated tobacco products that are out there. There's also a lot of our traditional combustible tobacco products like cigarettes, cigars, hookah, pipes, these and roll your owns. And then on the right column, we have a lot of these non-combustible tobacco products that are a newer category, including like nicotine pouches and snus, smokeless tobacco, and dissolvable tobacco. So you might have seen things like Zyn or snus, where there's no vapor, but people are still using them and still getting connected in with lots of nicotine through them. So there's a wide array of different products that are out there that can fall into these categories. And to be honest, the tobacco industry is constantly coming up with new things too. So it's always very surprising to see what they come up with to really try to attract youth. Um, and over the past few years, it's actually been really striking and alarming over how high these nicotine concentrations are in different vape products. Um, so in the before, we used to just have cigarettes. Um, they're still around. And then Juul sort of came up, and that was sort of like small USB vape products. And you could sort of see from like the Stanford Medicine graphic that it shows the amount of nicotine that is commonly in some of these products and like the equivalent to cigarettes. And then other vape devices started coming up and being developed. And now you have certain devices that have that are so significant that they can really contain a huge amount of nicotine that's equivalent to nearly 590 cigarettes. And this is really critical because it really shows that when youth are starting to vape, their brains are getting like covered in just huge amounts of nicotine. So sometimes when there's all these different things that make vape products attractive to youth, whether flavors or marketing or other things, their brains are just getting exposed to extremely high levels of nicotine, which can help lead to youth nicotine dependence pretty quickly. And another thing that is even more recent is the advent of video game vaping devices, also known as smart vapes. I've included some screenshots from some headlines that were out there more recently, but these types of smart vape products include features of smartphones and sometimes handheld gaming devices. So these can make vapes even more attractive to youth and can sometimes conceal their purpose, where sometimes it doesn't look like what a prior vape used to. And this is pretty significant and harmful because it can prey on different potential addictions, nicotine dependence, gaming, and screen time. So some of these have games that require a user to vape to progress in the games. So if you vape more frequently, you can actually get more points or reach a higher level in the game. And that can actually accelerate nicotine addiction too, because it sort of ties in with this whole reward pathway where the more you vape, the more satisfying it seems. And you could sort of see this FDA screenshot on the bottom where the FDA had warned firms that were illegally selling these because these products are actually not legal. I think this was actually from October of 2024 from the FDA. And this is just extremely focused on targeting kids. And from the American Academy of Pediatrics, this news article that was here is just really talking a little bit more about these two, how some of these have games, apps, you can like play different things on them, like standard arcade games. Sometimes you can even text people from them. So it's actually just really surprising to see what level of development the tobacco industry will sort of dive into to market to youth. Another newer topic that's been coming up too is around the hazardous waste and environmental threats of disposable vapes. Since these are actually not safe to throw away in regular trash, the nicotine e-liquid is a hazardous waste from like a disposal standpoint, and lithium batteries can catch on fire, especially when they're damaged. So these can be threats to health as well as the environment. And disposing of them is like a growing and costly waste problem for schools and other places that see a lot of these products. And you can also see some of the different photos around like a big collection of disposable vape products and even some of those video game vapes. And a huge amount of these are actually disposable vapes that are flavored nicotine vapes. So this is piling up more and more too. And Charlie mentioned our Supporting Healthy Youth work group through Washington Breathes. So our work group is actually focusing a lot on this issue. So there's more to come in terms of resources as well as opportunities to be involved. So if anybody's interested in either being involved or learning more, be on the lookout for more information in the future. And from a health standpoint, I'll dive in just for some background about the health impacts and substances in e-cigarettes. So with vaping, you have these devices that can heat up e-liquids and aerosolize them. And thus, vaping can convey ultrafine particles deep into the lungs. And this aerosol can actually have a lot of different substances that can be harmful or potentially harmful to the body. So one of these that we've already talked about is nicotine, which is very addictive and can harm adolescent brain development. There's also different chemicals that have been correlated with causing cancer. There's also different heavy metals, especially in some of the different components of vape devices. And then these tiny particles can be inhaled really deep into the lungs where they're more likely to cause harm. Um, and there's also different organic compounds, and some of these flavors that are used in e-liquids have been like linked in with serious lung disease. I always give the example of popcorn factories where diacetyl was a flavoring that was used in buttered popcorn that was fine for ingestion, for eating buttered popcorn, but when it's heated to an ultra high level and goes deep into the lungs, that actually caused a lot of lung disease in factory workers who are making the popcorn. And so many of these different flavors have not been tested with inhalation. And when we saw EVALI way back when, around like lung disease and lung injury, that was related to a lot of these particles that were being inhaled very deep in. And I always like to use this graphic from the CDC, which shows a lot of different aspects that are in there. So you have these vape products that look very colorful, but yet they actually hide so many different harmful chemicals in them. And from a nicotine standpoint, I always like to talk about youth developing brains. So youth brains are still developing into their mid-20s for frontal lobe development, especially. And while these neural pathways are still developing, they are uniquely at risk for different long-term and longer lasting effects when their brains are exposed to nicotine and different substances. So some of those risks include nicotine addiction, different mood disorders, and permanent lowering of impulse control. This can also change the way that synapses are formed, so that can really impact attention and learning. And this can also lead to dependence and addiction, especially in adolescents. So addiction can progress faster in youth than it does in adults just because things are so vulnerable. And that's why youth might become dependent on nicotine prior to daily use. And you can sort of see this graphic from the CDC too that talked about the negative impact on youth mental health from nicotine addiction. And I really like to come from the approach of nicotine dependence as a health issue, since nicotine, when people are using and exposed to nicotine, that exposure into the brain actually releases a number of different types of neurotransmitters. And that's actually why, from a medical standpoint, nicotine dependence can occur because there's really rewarding neurotransmitters where when you do things that sort of seem very like pleasure ridden, the nicotine helps release this, and you sort of get this reward pathway where people feel calmer, they feel a sense of pleasure when they use nicotine, and this can be very like stimulating, and you have endorphins. So all these very pleasurable neurotransmitters are being released from nicotine. However, when your brain is not getting nicotine and it's used to having it, you also have withdrawal symptoms that can make people feel really, really miserable. So you notice a lot of different things around fatigue, not being able to pay attention, not sleeping well, sometimes like brain fog, sometimes feeling more anxious. So I sort of mention this because I think a lot of this ties into some of the behaviors that people might sometimes see when youth are going to bathrooms to vape. It's because their brains are used to nicotine, and when their brain isn't getting nicotine, they really feel those symptoms. And that's particularly why I like to focus on cessation support and why it's so essential for youth trying to quit, because nicotine dependence really can lead to physiological withdrawal symptoms. So it's not necessarily just like a willpower issue, it's literally physical symptoms and mental symptoms that are happening. And um, I mentioned a little bit about this before, but around why youth are particularly vulnerable to nicotine dependence and addiction. But I also like to bring up the statistic that 68% of youth who vape have tried to quit, but almost two-thirds have had no cessation support. And that's why cessation support is so essential. Prevention is still incredibly important and a big part of what I think a lot of us are working on and trying to do. But because we already have youth who are noticing nicotine addiction withdrawal symptoms, we really need to help support them. And this is just a slide. I credit this to a colleague, Tammy D. We presented this at the Prevention Summit back in fall of 2024. But this pulls out some of the statewide data from Washington State, where now students who vape at school use vapes more often now than in years past. So on one hand, we've seen like a slight decrease in numbers of youth who are vaping, which is good overall. However, this This statistic I think is really striking because it just shows that students who are vaping in school who vape 20 or 30 days in the past month, which is sort of like a indicator of nicotine dependence, that's really gone up a lot over the past years. So instead of people who've just tried different things, they're actually now more regularly using vapes. And this is all data that's from the Washington State Healthy Youth Survey. There's also still a lot of different disparities in youth commercial tobacco use. So you could sort of see the breakdown from like a race ethnicity standpoint and sexual orientation standpoint, where sometimes youth from different communities of color or otherwise um, LGBTQ communities can be using youth tobacco products or using tobacco products at a higher rate. And this is why cessation support is also really important for addressing health equity issues. And for general approaches to youth, it is really important to offer supportive approaches when youth are caught using tobacco products. So punitive discipline doesn't work. And instead, it's really important to advocate for a just culture and really focus on supporting youth. So sort of going at it from a nobody's perfect and trying to delve a little bit deeper into any like reasons for why a specific youth that you're talking to is vaping. So you can try to see if they're undergoing a period of stress or if they're trying other things, um, just trying to get a better understanding of any causes leading into it. And then instead of focusing a lot on discipline, I think it's more important and also more effective to really focus on assisting them by stopping tobacco use. Also, really important to ask confidentially and without judgment. And some other aspects that can sometimes be useful is asking whether the teen understands the health consequences of vaping and sort of approach things from a motivational interviewing mindset. And then some other things that have sometimes been useful is messaging around health consequences, the chemical exposures, and also just really explaining that youth are being controlled by the tobacco industry and like marketing and all this product development that's really targeted towards youth. Since nobody likes being controlled by like a large industry. So I think sometimes that can help. From a healthcare approach to youth nicotine cessation, the American Academy of Pediatrics has a lot of different resources and recommendations around the ask, counsel, and treat approach. So with this, I'll delve a little bit more into it. But with this, with the treatment part, there is also a focus on linking youth with cessation support, including behavioral as well as pharmacological cessation supports. And a lot of this is really tailored for each youth to sort of ascertain their level of dependence, but also link all youth who are seen as using tobacco or nicotine products to behavioral support. And then you can also consider pharmacological support, like the nicotine replacement, for youth who are severely and moderately dependent. And the AP has a great website around this, which is ap.org, Help Kids Quit. You can see some photos of nicotine replacement therapy, gum, patches, and lozenges, and a photo of a behavioral support tool. And for the Ask Counsel Treat model, usually we're screening all youth for tobacco use. This is something that we do in clinic frequently. And we also advise all youth who use tobacco to quit. And then with the treatment, there's the different components of behavioral as well as pharmacological support, and also a strong focus on follow-up for supporting and offering help as kids progress. And you can also use that to sort of see where they're at. If they sort of haven't made as much progress due to other competing priorities, that's still fine, but at least you can see where they're at and meet youth where they're at and continue to offer support as you go along. And for the ask part of the ACT model, the universal screening part helps with countering bias, and it's always important to screen confidentially. So in a pediatric clinic, we usually do this during like teen well checks or other visits, but this could also be used in schools. And then we also ask about use of any tobacco product and sort of use language that youth can understand. Sometimes in clinics, we'll use different screening questionnaires that can be useful. And I think it's always important too that you can sort of open the door. And sometimes if you're just trying to dive into a conversation, you can ask first about friends' youth and just sort of what people have heard. And for counseling, regardless of level of use or dependence, even if a youth has just tried something a few times, I think it's great to still connect them in with resources. And When you're advising youth on quitting their tobacco use, it's important to talk about the different health aspects. A lot of teens I talk to don't realize that their brains are still developing, and sometimes that's helpful just to help frame the conversation and really explain that this is why nicotine can be so impactful for youth. And I think that also helps clarify different things too around like why youth use is so harmful and dangerous. You can also try to be pretty personalized with linking the benefits of quitting to the youth's other interests. So, for example, in this little speech bubble, it talks about like a youth athlete who's running cross country, where sometimes quitting smoking or tobacco use can help with lung capacity and help them with their goals of their athletic performance in different ways. There's also other benefits around besides their health, right? Saving money and having more control over their lives and not being dependent on nicotine anymore. And also really important to just have an open, honest conversation, meeting youth where they're at, being really respectful, non-judgmental, and just really trying to come from a position of understanding. Also try to see where they're at, like how long have you been using a product? What kind of product have you been using? Are you interested in quitting? Have you tried quitting? What's happened? Have you been noticing any signs of dependence? So all those different nicotine withdrawal symptoms that were on that slide with the picture of a youth like in a bathroom, right, vaping, sort of ask, like, have you been noticing these different things? And then also ask them like why they started to use some of these products. Are they self-medicating? Sometimes I have patients and teens who might have underlying anxiety or other concerns and might be self-medicating in different ways, or if they're navigating stressful situations. And that's where sometimes you can tie it into with other resources. But if they are showing interest in quitting, it can be very effective and useful to help them set a quit date and also connect them with different supports. For counseling too, it's always up to each youth, but in talking with youth, I sort of try to gauge like how comfortable they might seem with including their parents or caregivers in a quit attempt. And then um, if they agree to that, I'm always like open to talking with the parent to helping them understand that the tobacco use is not just their child's fault, that this is actually like a health condition, and really has a clinical basis around it. And then if the parent is using tobacco, you can talk to them about quitting together as a family. However, if youth do not want to engage their parents, this is a time where it's really important to respect their wishes and keep things confidential. And if they're not quite ready to quit, can also offer up like partial aspects too, like a 2-week challenge to reduce their use or to see if they can stop for that time frame, and just offer them different opportunities to still sort of loop back in and know that there's resources available when they're ready. And then it's also great to follow up. So even if youth are coming back in for other things later on, still really good to sort of touch base and just sort of see where things are at. And for treatment, talked a little bit about the needs for both behavioral supports for all youth, um, because that can really help increase the odds of a successful quit, but also the pharmacological support for those who are more dependent. And here are some examples of different behavioral supports that are available in Washington State. This can come in different types of forms, including text-based programs, web-based programs, apps, the Washington State Quit Line, and in person sometimes, depending on what like local resources are available. And components of different successful quit plans include setting a quit date, developing a plan for managing triggers, and developing strategies for managing withdrawal symptoms, whether cravings, irritability, and other things. Also good to sort of come up with social support, whether it's family or friends who can help encourage successful quitting, and then also self-care for other aspects. And you can see some different examples around some of the resources like the apps. The quit line. And with the AAP resource, there is actually this progressive web application that's online that I actually think is pretty helpful for helping ascertain what level of dependence a youth might have with nicotine addiction and dependence. It's like a pretty straightforward web application where you can pull up different questions that you can talk through with like youth where they can fill it out or you can go through the questions and fill it out with them. And based off of the frequency of some of these responses, to questions such as like, I find myself reaching for my e-cigarette without thinking about it. I drop everything to go out and get e-cigarettes or e-juice. I vape more before going to a situation where vaping is not allowed. And when I haven't been able to vape for a few hours, the craving gets intolerable. This actually helps show what level of dependency there is, whether it's moderate or severe. There's other screening tools that are available too, but I find the web one to be the most accessible and easy and straightforward to use. And for those youth who do have moderate or severe dependence, there is nicotine replacement therapy that can be used for these teens. So this includes gums, patches, and lozenges. And because the effectiveness of NRT for adults and because of the severe harms of nicotine dependence, the American Academy of Pediatrics does recommend considering off-label NRT use for youth who are moderately or severely addicted. For youth who are under 18, they will need a prescription for this. For 18 and above, people can actually access this over the counter, but for under, it's still something that needs to be prescribed from a healthcare provider. And there's different things to consider for use. This is actually safer than cigarettes, e-cigarettes, tobacco products, since it delivers the nicotine without the toxic chemicals and carcinogens, since these are all approved and have been proven to be safe as well as effective. Plus, the NRT has very low potential for misuse because nicotine is absorbed slowly. And there still can be non-adherence and also relapse of cessation after therapies, which is why close follow-up is still recommended, just to see where youth are at in their journey, and also just providing more help with this. And a lot of times you can select the type of NRT, whether they want like a gum or a lozenge, based off of their preference. And I usually talk to them and help educate them about using it. And you usually pair a longer acting form like a patch with a shorter acting form like gum or lozenges. And that helps keep a steady level of nicotine in the bloodstream while managing breakthrough cravings. And I mention this partially because this can be seen sometimes at school where I've written prescriptions for patients and helped fill out school medication forms where they can get their gum or their lozenges and self-carry and self-administer at school. And they can just put on the patch at home. And then for follow-up, it's really essential to assess progress, offer support, and also adjust things. So you can touch base about, did the youth stick to their quit date? Are they using any of the behavioral supports that you connected them with? Is it helping? If not, you can offer up a different support or a different type to see what might work better with their lifestyle and their preferences. Are they using the medication? Did they pick it up? Did they start using it? What were their experiences? Did they find it to be useful? If they're trying to still troubleshoot it or they never even picked it up, touch base again, try to answer any questions and help with troubleshooting. And if they've and also specifically ask them, have they used any tobacco since their quit date? If no, congratulate them and encourage them. And if yes, let them know that relapses and slip-ups can be common and quitting can be pretty hard, but help them plan to sort of avoid another relapse by getting some of those supports in place and shored up. And then here's some of the Washington State resources that mentioned a little bit about and more specific links so that way you can access them for any youth that you might be working with. So the DOH does have a link to the Tomorrow Health app, which I think is pretty great. The Truth Initiative also has a program where you can text different things to this number, the 88709, like vape free X program, and that comes up with a program. You can sort of see this little graphic on the right side, this little pink purple poster about You Got This. And this also links to the X Text program. I think that's actually linked in from the Mayo Clinic, which helped with developing it. And that has a lot of support for cessation. There's also some posters going around that have Ditch Jewel on them. You can still text that to the number because this poster has gone through various renditions and all of those still work. I actually tested them out recently in preparation for this webinar and they're still pretty active. So youth will get something back asking them for their age and asking them if they're ready to start quitting. There's also the Washington State Quit Line, which I think is a wonderful resource. So you can call 1-800-QUIT-NOW. And there's also Smoke Free Teen, which has a great website. They also have a text-based program as well as an app, as well as other things on their website. And most of these resources are listed on the Washington Breathes website too, around the cessation treatment section for different resources. And I did want to point out some specific AAP resources that are meant and geared towards schools too. So there's different toolkits that have been developed, including these PDFs that are online from this link that's on the screen. And there's different PDFs that you can share with youth or print out or just share electronically. So I don't those will be available online, but it really goes through the Ask Consult Treat model and different approaches, and also talks about nicotine tools for support, like the gum and the patches. And also, I really like this one too around making a quit plan. So it talks about the different symptoms and different steps. So about quitting, preparing for withdrawal, gathering social support, making a daily plan, preparing for triggers, sometimes building a quit kit. and then practicing self-care. And there's different QR codes too for more information on each of those different PDF toolkits. And these are from the AAP, and they actually, I think, had some collaboration with the American Heart Association. And this is a listing of some of the different resources. Like the Department of Health has a great website with some different options too, in addition to the ones that were listed. And you can also call the quit line to request any rack cards or wallet cards. There's also an option through, I think it's through the University of Washington, through the ADIClearinghouse.net, where you can request printed materials. I really like this for getting posters and other things that like I've put up at my clinic and that you can use in your schools too, to try to help make the different behavioral supports more visible for youth. Um, and again, here's just the links too for some of the AP resources. And that's my content that I was aiming to share today, but I am happy to answer any questions. And this is also my email address, where if you have questions that you think of later or want more information about resources, you are 100% welcome to email and reach out. But I will go ahead and stop sharing my screen for now to help with the questions. Yeah, but if anybody has any questions, feel free to chime in. And if not, I'm actually just curious to find out more about people's experiences about what you've been seeing in your own settings, whether it's in a school or somewhere else, including like what products you've been seeing youth use, some of the challenges that you've seen in terms of trying to support youth who might be interested in quitting. I always like to glean a lot of input because I feel like the variety of perspectives is really, really important for better understanding some of what people are seeing, so that way you can help improve what is being offered to youth. Okay, Julie, go for it.
Thank you. That was fabulous. A ton of information. Appreciate it very much. Wondering if there are the slides that you did, because there's so much on each individual slide. Are you going to send those out to us as well?
Yes, so I was asked in advance to see if our slides would be available in PDF form to be sent out, so I'm totally on board with that. Yeah. So that
Great.
way you can,
Thank you so much.
and I always like having the links like pasted on there so that we can actually read the links, because on a PDF you can't actually click the links. So that's why I was like double checking that all the links are active links as of like the past 2 or 3 days. So
And I did have one more question. I'm wondering, you had the Truth Initiative is one that we had used last year. I have a group that I work with through our coalition, Next Generation, and we did a campaign to the middle school, but it's always challenging to peer to peer when it's your age group. And so that can be intimidating sometimes, but they were concerned about their peers and smoking and vaping. And we had used the Truth Initiative poster, and I did call them about getting additional ones. So I'm anxious to see what link that you have. But it doesn't have any kind of a QR code. It does have the type in piece. Um, the reality piece that came up at one of our next gen meetings is, one, most students probably might not type into it, entering that much of a code, but they use the phones a lot more. And two, we had it in the bathroom stalls, and you're not supposed to have your phones in the bathroom. So that was interesting. It was like, oh, okay, what kind of message are we sending out? So leave it up to the kids to come up with the great information. But we had them all over the walls and stuff too. Is there a way of getting the QR codes for some of the things that you're recommending as the poster forms? What would you suggest for that?
I think that's a really great idea. I'm not aware of one that's already developed, outside of like some of the AP resources have like the QR codes for their resources, which are more geared not towards the youth specifically. But I actually think it'd be pretty great just to help develop like a QR code that youth could scan. So I think that's amazing. I know sometimes for presentations or pediatricians and things, I'll like, because you can generate QR codes that just go to the links. Or if somebody was curating like specific ones that were like local or Washington state specific, it'd be nice for somebody to be able to link directly to it. Because I know like the websites are pretty good where if you type in the website, you go to it, but it'd be so much easier just to do with a QR code. I agree.
And I did notice on the Truth Initiative, they had said to please do not change anything on their poster. So that was why I was curious if you had, and I can get a hold of them again. They were great when I called the first time. So that was just a conversation got brought back up.
Well, that's great
Thanks.
input that you already heard some from it. Yeah, I know some, like, it was sort of interesting. I was actually developing a list of resources for pediatric residents because I actually help, like, with precepting different Seattle children's residents around teaching around some of this too. And just creating like a quick resource sheet, I think is sometimes useful because a lot of times it's great to have slides, but having something that you can just like hand out, or when I'm in clinic, I often hand out like a little sheet of different things that people can see. Or I have a lot of things that are posted. So when people are waiting, they can sort of look at it too. So yeah. Even if there's a QR code just to that list. I've actually seen, I'm trying to remember, I think like a colleague had actually made like a little wallet card too that just had a few of like the different links that were on it. And that was sort of nice that they could just print out and give to youth too. So, but I think that was more tailored for their specific geographical area. So lots of good ideas for making it more accessible. Oh yeah, and I see Margaret's comments in the chat too, that there's a contact with the Truth Initiative, so I can pass along that request for their poster. And Washington Breathe did not help design it. Yeah. And I think using like peers at school to help spread the word, I think is really great too. It's like, hey, here's this really great app that I heard about, or hey, here's this really great resource that I heard about. Like I've been like my clinic actually is like a teen clinic for contraception and other things too. So I've been sharing lots of things there. So that way when people are looking at everything, right? That way they can see the whole, like can see a lot of the different updated options. And I see Lily's a question too. Is there any material in other languages than English for our youth? That is a really great question. I know the quit lines are available in multiple languages, which I think is really great. And I want to say, I think some of the other material might be as well, but don't quote me on that because I was looking through all the different websites just to make sure all the links were still active because some things have changed over the years. But I think that's a really good question too. And I know that AEP, at least for their behavioral supports, does have different like national options too, including things in different languages. So I feel like there's a lot of like larger things that are available that are like national level. And then I also think the Washington state ones are also really great to know about. So it's trying to find things that are like Washington and youth specific, but sometimes it's trying to find like knowing about both and then trying to find a good intersection is good. Oh, and Margaret, it's always amazing with resources. Yep, and mention the quit line in Spanish and translation services that are available as well in over 240 languages. Thanks, Margaret. And the Asian Smokers Quit line.
Very much appreciate the comment, though. We'll take a look to see if we can link from our website to some materials that might be for youth. Generally, a lot of the materials that Washington Breeze is producing are more for adults because we're working on the policy systems and environmental changes around this. But really appreciate these comments. Thank you.
These comments are great. And then I saw Angela's question too around, is there a quit day countdown app or resource available or delay of use timer possibly already built into a resource? That's a really good question. I'm actually not sure. I know for setting a quit date, that's a really important part of like setting up a quit plan. And I'm actually not sure if the app's involved that, but I think that'd be a really great resource to include too. And Johanna, I really appreciate your comment too about how the American Heart Association has translated some youth materials and has quit posters that refer to the Truth Initiative as well. Yes, that's why I always appreciate like all the different collaboration because there's so many, so useful just to learn about all the different resources that are out there. And it's great that there's more that are being developed and translated. Yeah, and I always feel like the behavioral supports are the things that are great to sort of make known pretty widely because that way youth sort of know that they're out there and know that they exist and know really specific resources for where they can find help. I feel like making that just like a commonplace thing that's like all over the place so that way people, even if they Or like, oh, I have a friend who's vaping and they need help quitting. Oh, I can connect them in with this. It was great. So I was like having like the broad list of resources, and then I try to curate sometimes when I'm talking to an individual teen to see what their preferences are, sort of see what they might like. Any other questions? Or does anybody else have any ideas on what they think would be useful, like with either forms of resources and how they show up, like the QR code, which I thought was a great idea, or other types of resources that you think there's a significant need for? Oh, Lily, I see your hand up.
Was just thinking that the youth that sometimes I exchange information, they're already advocates and they're trying to do their best, but sometimes the resources are not that easy to find. And maybe like more social media presence, more billboards, more um available resources that are easy to find, pretty
But
much.
do you think any social media around some of the resources would be useful that
I
teens could
think
just...
Instagram, IG, yeah, it's really popular with youth, and TikTok also.
Sophia, I see your comment too. Also seconding TikTok. Okay, that's helpful to know too.
Yeah, I agree with what Lily just said, and it's that again, I'm not here promoting Truth Initiative, but it was one that started marketing pretty early on in it. And I had, again, my students came in and said that they had actually seen it several times on the social media. They had seen the Truth Initiative and they'd seen that actual poster come up. And that's, we all know marketing. We all know that when that's familiar and safe, it's a spot that we can get them to link to. So I agree. And then you had mentioned something about the Washington Breeds, that you have links. Do you have youth links that can be shared for the social media that would uh, be interesting to the youth? You were talking about it's more adult.
Well, I know the Washington Breed's website does have a section around cessation resources. I don't think it's been like formatted specifically to be like designed in mind for youth, but like a lot of the resources are there, so that still can be shared with youth. It's just not like intentionally designed to be like an Instagram style post, but at least it's like all lodged on there. I mentioned that because I always like to look at all the resources, but sometimes when there's a lot, it's nice to know where like a repository is with like updated and current resources. So, and I always really like a Washington Breeds website, so I like to direct a lot of people there too to look for things.
On the social media resources that Washington Breeze has produced, and that's what Charlie talked about at the beginning, I would encourage you, as someone who works with youth, or if you're an educator, why don't you screen those first and decide whether there are ones that you think are useful for the age group that you work with or where they're at. They really are designed a bit more to point out, for example, that, we about more than a dozen years ago or so, our state was funding schools directly to help with nicotine prevention and cessation. It was during a period of time when smoking rates for both youth and adult came down greatly because our state was investing in those programs. And we've been in a long period here of a lack of that investment. And unfortunately, it has, at the same time, e-cigarettes started flooding the market. So it's been a double hit for our youth, and hoping to dig out of that hole soon with some more state investment. Um, but so that's part of why we're getting the message out that really people who support youth need more help in this arena, need more resources. We need that mass media campaign. But yeah, perhaps some of our social media would be valuable, for older youth, for example, to help them understand really how the industry is manipulating them too. And yeah, your feedback is welcome, and we're taking notes. And if we have resources, we'll try to address some of these things.
The um oh, I'm drawing a blank. There's a training that they do here in Anacortes, and it's through oh, I'm in so much trouble. I've drawn a complete blank on it, but it's beautiful, and it's teaching peers to educate other peers about the marketing and what the big tobacco companies are doing. And so that is a program that I highly recommend that people attend in the Pacific Northwest, and it really helps our kids, empower our kids to be able to get out there and share some of those messages. All the things that you're just saying, and I've been doing this for a very long time, and we used to do uh, tattoo Teens Against Tobacco Use. That was funded through the schools. It was great, and they would teach, the nurses would come in and teach our young people. So I agree with you. I hope it comes back in formats like that. But and I also agree about teaching them about the social media and the big back tobacco companies and how they're literally marketing to them.
That training sounds really great. I think that's one of the things that I really value about the Washington Breathes Coalition is just it really pulls people together statewide so that we can all share information and resources because there's so much that's useful to hear about and then you can help connect the dots too. Where I just always hope that youth who are looking for resources are able to have a good sense of what's out there. At least that's my aim. I'm trying to make things more accessible. Oh, and I wanted to point out too that Margaret had put a link in the chat too a little bit earlier about ideas on school policies around student youth of commercial tobacco use. And that's on the Washington Breeds website as well. Any other questions? Yeah. And I think it's edifying to see youth who are able to quit because partially it's incredibly, nicotine addiction can be incredibly challenging for youth and adults. And that's why there's always the possibility of relapses or as things get more stressful, right? Like the brain just really craves more of that nicotine. But I think helping set youth up with an idea and an understanding, hey, this might be challenging, but here are the different things that exist, and we're happy to keep on working along with you during this journey is useful in helping people tie in with some of those resources. And that's where I think setting up the quit plan, figuring out the triggers and other things can be useful. Yeah, and I was going to mention too, most of the patients that I see are pretty much all of them in primary care are on Medicaid, and NRT is available and covered by Medicaid, at least for my patients. I've talked with the pharmacist at my clinical site, and yeah, and they were able to access that.
All right.
Mhm.
Good questions from everyone. Good feedback and comments too. Dr. Shen, I want to thank you for your presentation and to everyone for showing up this afternoon and for the questions and comments. They are so appreciated. We'll share the slides from this session with everyone who registered. And we have links to these cessation resources on our cessation support website. As you can see here, the screen is being shared. And then there's a link in the chat to it as well. And then on our next slide, we also have resources on our website about the policy and systems changes that are needed to reduce youth commercial tobacco use and to improve cessation services. And those changes include providing more resources to schools and to youth-focused community-based organizations, just like we were talking about. Our materials aren't youth-focused, but we have several that highlight actions to support healthy youth. So just a lot more info, more resources for everyone. And then finally, again, talking about the certificate of completion, thank you for coming. Before you go, there's a link in the chat. Please fill out our webinar evaluation form. Very, very important always to get feedback about these webinars that we're running. So the link is in the chat. If you could take a few minutes, probably no more than 3 minutes, to complete that evaluation form. And please look for other upcoming events on our website, and we hope you'll get involved with Washington Breathes. And about those certificates of completion, let us know if you would like one by completing the participation form that is linked in the Zoom chat. So again, thank you all. Lots of great information today. And Dr. Shen, Crystal, thank you so much for this great presentation and great amount of info.